Hi, everyone. My name is Tim Reha, host of Informed Health 2015. Wanted to thank Einar again for having me down and do this at UCSF. We've got some amazing talent here today, people really changing the world of healthcare. We got David Schawitz, who's a Chief Medical Officer for
DNAnexus, that's right.
DNAnexus.
Right, it's a genomic data management cloud-based company in Mountain View.
Yep.
But the reason I was here, one is for Einar Sawyer, who's an amazing leader, a thought leader in digital health, and an amazing connector of people and team builder. And it was my privilege to host a panel discussion with two of the smartest people I know, Alvin and Thomas, who I think you'll be speaking with in a little bit. And basically the panel was on how can all of the new data that's coming out and all the different data sources really be leveraged best to drive an improved care. So Alvin is a physician on staff here at UCSF, and he was talking about how the challenges of actually even getting access to the data, leveraging it, getting hold of it, and how you can use it to really, to improve care, to improve medical education, and it was just an incredibly inspirational talk. And then Thomas was approaching the similar question from the consumer perspective, trying to say that there's a theoretical view of medicine where it's this is precision medicine, everything is very highly scripted, but then there's the reality, which is the complexity of real world medicine. And what his company Iodine is trying to do is really trying to capture some of that complexity by really understanding how do patients feel about the medicines they take, what do they like them.
Yeah, there's like placebo effects. There's all kinds of interesting other
placebo effects. There's complexities. There's which ones are hard to take, and which ones really make you feel. Which ones are the ones that have the most significant impact. So the impact coming out of all of these talks is that there's a huge amount of data, and it's incredibly important to be able to bring them together and to really be able to share them. What there's, I thought, a lot of consensus around is, and something that DNAnexus is strongly involved with, is really trying to create a platform where rich data sets, starting with genomic data, but including a range of other data sets, can be brought together in a safe, secure way and shared, collaborated around among authorized users. And so you can really get the insights that come from bringing and colliding together large data sets and getting the insights that everyone has in their data sets, but which are struggling to get out, struggling to be liberated. It's particularly exciting to be here today at UCSF, where they've just hired Atul Butte, as you probably heard, to run their whole institute, focus on this exact challenge. He is the perfect person for this role, and it really captures UCSF's vision here to really be a leader in Bay Area data science and to really drive the entire field forward. So it's a privilege to be at UCSF, privilege to be part of something that Einar Sawyer is leading, and I'm incredibly excited to be on this panel, to be helping lead this panel, and to be to know that Atul Butte is going to be running the Institute for Computational Informatics.
So it's changing the landscape of digital health in this area, really putting a lot of dynamic team members together in the brain trust.
Absolutely. I think that the Center for Digital Health Innovation at UCSF has really been at the forefront. And one of the points that Atul Butte made in his comments, one of the things that attracted him here was that actually on the medical side, UCSF has an incredible view of entrepreneurship and recognizing the importance of both of partnering with the private sector, of partnering with innovators, of trying to bring the best people together to drive science forward and to drive and to catalyze innovation. I think Susan Desmond-Hellmann, now head of the Gates Foundation, but the former chancellor, played a pivotal role in this. I think she set an incredibly productive, positive tone, where the real goal isn't to say this is academia, this is industry, but the real goal is these are important, critical problems to solve. Curing cancer is hard, as Thomas talked about. Solving these incredibly complex medical problems, we're going to struggle to do it enough by having the very best people. So you don't need to create additional barriers. And so by creating in a transparent way the opportunities for the best people from academia, from industry to collaborate and work together and to drive innovation is something that DNAnexus strongly believes in, that UCSF strongly believes in, I think the panelists here believe in, and it's an incredible opportunity to really be part of what I really believe is digital health and this really big data revolution, where our goal is to not just sort of parade out a series of buzzwords, but to really to present some of the hard data that Alvin was talking about, that Thomas is collecting, where we're really going to be able to see some of these broad data sets inflected into improvements in patient care. We're seeing that now even in genomics. 25% of patients who have exome, who have an undiagnosed disease, can have it resolved now largely through exome sequencing. I expect that number to increase more, but the challenge for oncology is everyone's collecting these sort of siloed data sets. And we have the technology through the use. Yeah, everyone's collecting their own little data sets, and they're trying to find ways to share them in a federated way. But the truth is, we have the technology. We have the cloud-based technology that, for example, that we've built at DNAnexus on top of AWS. It offers an incredibly attractive platform for bringing together diverse data sets, and we're doing it with Baylor. We're doing it as a contributor to the Charge Consortium, and we really we are in the process of developing there are multiple opportunities that we're involved with to really try to bring the benefits of large data collection and collision and sharing collaboration really to bear for the benefit of patients.
Nice work. I don't even need to host an interview anymore because you're knocking them out by yourself. But hey, that's David, and we do want to thank Einar and the whole team here.
It's the best. We love Einar.
For making this all happen. So David, great work, great job. I'll have to come down and check you out in your neck of the woods.
I hope you do. It's a great time.
How do people get what's your website?
At DNAnexus.com, DNAnexus.com. Or follow me on Twitter, Schawitz, at DShawitz, DSHAYWITZ.
All right. Hey, David, thanks for being on the show, and we will catch you down.
Appreciate it.